All right. So again, good evening, everyone. My name is Caitlin Minch, and I am the recruitment advisor for the University of Maryland School of Public Health. Wonderful to be here with you all tonight to share more about the School of Public Health at the University of Maryland. Right. So this is our agenda for tonight. I'm going to talk about the field of public health at first, the majors we have in the School of Public Health and some of our stats, information about getting involved outside of the classroom. And then we have some wonderful current students here with us tonight who will be able to share a little bit more about their experiences. We'll also have time to take questions at the end, either for myself or our student panelists. So please start thinking of them. You are welcome to drop them in the chat at any point. And I can either pause to ask them, or excuse me, to answer them in the moment, or it might be one that I save for a little bit later. But don't hesitate to drop questions in the chat. Okay. And again, I'm Caitlin. I'm the recruitment advisor for the School of Public Health, which means my job is to help students like you decide if you want to come study public health with us. I am a University of Maryland alum. That's a photo of me and my husband when we were freshmen here. So I do love the University of Maryland, and I really hope that you do too. And that's what tonight is all about, is learning if this is going to be a good fit for you as well. Okay, so let's talk first about what is public health. Public health is all about promoting health, preventing disease, and prolonging active, high-quality lives, right? So it's a very preventative focused field. So if you think about it in comparison to just the regular medicine field, when you're a doctor, you are treating one patient at a time, usually with a pre-existing disease or illness. In public health, we are trying to prevent those diseases and illnesses in the first place, and hopefully on a much larger scale, right, for everyone across the globe. Public health is around us in all kinds of everyday things like no smoking campaigns, vaccines, promoting healthy diet and exercise, looking at the effects of the environment on health, family therapy. All of those things comprise public health, alongside things like mental health, health literacy, healthcare access. And those are just some of the topics that you'll be able to study here in the School of Public Health. So hopefully some of that sounded exciting to you. And if so, you are in the right place. All right, here are some of our stats as the School of Public Health. We have 5 different undergraduate majors, which I will talk about tonight. We have around 2,000 undergraduate students and around 500 graduate students. That puts us at sort of the small to medium end of schools and colleges at the University of Maryland. In case you didn't know, at UMD, we organize all of our majors into groups and schools and colleges. So we're the School of Public Health. We're all about public health. So I think this makes a nice sort of counterpoint to the large university, right? You get the big University of Maryland with the resources, the athletics, all of that. But then you also get a smaller academic home, right? You're going to get to know the other students in your major. You'll get to know your advisors. You'll probably have repeat professors. So it is kind of a nice small community feel there. In terms of our student body, we are one of the most racially and ethnically diverse schools at Maryland. We have 61% students of color and around 28% first-generation college students. And these are our 5 majors. So I'll give you the quick 10-second definition of each of them, and then we will go deeper into each one, right? So our first major is family health, which is all about studying family relationships and their impact on health and well-being. Global health is all about studying health challenges across borders, sciences, cultures, and environments. Kinesiology is all about studying movement, physical activity, and sports for health and human performance. Public health practice is all about studying community-based research and interventions and programs for promoting public health. And then public health science is all about exploring public health through a life science lens. Right, so those are the 5. I would like to note that none of these majors are what's called limited enrollment programs. They are all open majors. The University of Maryland has several majors that are limited, meaning they are very popular and there's only so much space in them. So for those majors, not only do you have to get into the university, you also have to do a review to get into the major. But luckily, none of our majors are limited enrollment, meaning if you apply to the University of Maryland with one of our majors and you get it, you can go straight into the major here. And I'd like to also clarify that all of our majors are great for health professions. So I imagine there's a couple folks on the Zoom who are interested in medicine, dentistry, physical therapy, physician assistant, etc. There is no one right major for going into those professions. You can be any major. You could be an English major and go on to medical school. So I encourage students to think about like what background you want to have, what topics you find interesting, and you can work in the classes that you need for those programs into just about any major. So again, any of ours are great for that. Okay, so let's dive in a little bit deeper into each of these majors. Um, and first, before I do that, let me tell you, we also have some minors. So we have some minors in the Department of Kinesiology. We have a minor in biomechanics, exercise physiology, and then sport, commerce, and culture. So these are for students who are outside of the kines major, because if you are a kinesiology major, you're taking these classes anyway. But if you're outside of the kinesiology major and you have an interest in these, you are welcome to add these minors. All right, so now we'll dive deeper into each of our majors. And to do that, I like to ask a little quiz question. You do not need to respond or drop your answer in the chat or anything like that. This is just to give you an example of topics from each major. Okay, so you can just think about your answer. So my first question, according to the CDC, what percentage of children and adolescents received counseling and therapy in the US in 2022? Do you think it's A, 4.8%, B, 7.8, C, 13.8, or D, 15.8? Okay. The answer is C, 13.8, right? And this is an example of a topic that you would study in family health, right? Family health, again, is all about studying family relationships and their impact on health and well-being. So if you think about topics like family law, family finance, maternal and child health, couple relationships, violence in families, mental health, these are all topics that you would study in the family health major. Some of their popular courses include mental health and healing in families, right? That gets to the topic of counseling, right? That maternal, child, and family health class. There's an entire class on fatherhood in America called Man Up, right? So some really cool things studying families and their impact on health. With a degree in family health, we see students going on to careers in social work, in family law, in the various health professions, becoming like a rehabilitation counselor, working with youth and foster care, etc. And as part of this major, you do a 3-credit internship, a part-time internship during your final semester. So it's a really great way to step into the field. All right, so now to talk about global health. Around blank percent of human infectious diseases spread from animals. Do you think it's a 10%, B 15, or excuse me, B 25%, C 40%, or D 60%? The answer is D, 60%, believe it or not. So this includes things like COVID, SARS, MPAX, etc. Again, there's this kind of concept of One Health, right? That it's not just human health that's impacted, but we're all connected to human health, animal health, plant health, right? We are all one health, essentially. So that's a topic that you can study in our global health major. Again, it's all about studying health challenges across borders, sciences, cultures, and environments. And some of their popular classes, they have a class on environmental determinants of emerging infectious diseases. They have a class on comparative healthcare delivery systems, right? Again, it's a very globally minded program, right? They like to say, diseases don't know borders, they're going to spread no matter what. So it's important to look at so many of these issues from a global perspective. With a degree in global health, this is one of our newest majors. So we're hoping students are going to go on to careers as like a global health program manager, program assistant, potentially in the area of policy, potentially global law, right? A number of different areas there. And this major requires 2 different experiential learning opportunities. So that could be things like study abroad, internships, research, or something called a global classroom, where you are still here in the US, but you attend a global class virtually. Okay. All right, so now to introduce kinesiology. Most people recover from a concussion within 2 to 4 weeks. However, blank percent experience persistent post-concussive symptoms. Do you think it's 20, 30, 40, or 50% of people? Right? The answer is 30%, which is actually a lot, right? And the hope is that if you engage in some very light, mild physical activity, that could potentially reduce those symptoms. And that's an example of the topic that you could study in kinesiology. So kinesiology is all about studying movement, physical activity, and sports for health and human performance. So the program likes to say you're going to study everything from cell to society, meaning you'll take classes in biology, human anatomy and physiology, but you'll also take classes like sport and American society and psychology of athletic performance. There's some other really cool ones like prosthetics for limb amputations, that biomechanics class, right? Some really cool ways to look at movement and physical activity. With a degree in kinesiology, it's really popular for students to go on to want to be physical therapists or occupational therapists. But there's also a lot of students who want to do athletic training, personal training, owning their own gym, becoming a PE teacher, etc. If you're interested more in the business side of sports, we also have a sport management program with the Smith School of Business. So that's an opportunity there. And one of the most popular questions we get asked is, can I work with the UMD athletics teams and the student athletes? And the answer is yes. That's one of the most popular internships for the kinesiology major. Okay. Next up is public health practice. All right. So in a 2019 study, preschoolers who watched Gali Gali Sim Sim, which is the Indian version of Sesame Street, showed improved literacy, numeracy, social emotional strategies, and nutritional knowledge. Do you think this is true or false? The answer is true, right? And one of our wonderful professors, Dr. B, is one of the folks who worked on this show. She helped to develop a couple of different Muppets that have public health messages. So again, that's just a really cool example of public health practice in action, right? So it is all about all about community-based research and interventions for promoting public health equity, okay? So in this major, you're going to study things like multicultural population health, social media and digital tools, making a difference, applying community health practices, right? A lot of really hands-on based people work, but there's also work in sort of that messaging, communications, administration, coordination side of public health. The example I typically give is if you've ever seen a commercial that was clearly targeted at teenagers to convince them not to smoke or vape, that's an example of public health practice in action, right? The research to determine that's a problem, followed by communications and interventions to hopefully improve the health behaviors. Okay. Public health practice, they require a full-time internship during your senior year, which again, really great way to get into the field. And with a degree in public health practice, we see students going on to be health and wellness administrators, research analysts, epidemiologists, etc. Right. And now, finally, for our public health science major, according to the CDC, there have been over 1,300 cases of measles in the US this year so far, as of this past July. Do you think that is true or false? Right? The answer is true. There have been over 1,300 confirmed and reported cases of measles in the US as of this past July, right? So that's an example of a topic that you could study in public health science. They have an entire class on vaccines and immunology that you could choose to take. Again, public health science is all about studying public health through a life science lens. So their curriculum is half lab sciences, and half a survey of different public health topics. So you'll take classes like biology, chemistry, organic chemistry, genetics, etc. But then you'll also take classes like a health policy class, introduction to behavioral and community health, epidemiology, etc. So some of their other popular courses, there's a class on food policy and public health, how to address social inequities through public health biology. Again, lots of really cool topics and heavy on the sciences. With a degree in public health science, we see a lot of students who want to go into the health professions, who want to go into research, potentially working for health departments or nonprofits. medical assisting, etc. Okay, so those were our 5 majors, but I do know, as students, you are very well-rounded, and there is a lot to do outside of the classroom, right? I will let our students talk about this in a minute, but we do have a lot of different activities and engagement opportunities outside the classroom that are still based in public health, to help kind of give you that well-rounded experience. So there's honor societies, professional development opportunities, study abroad, student orgs that are related to public health, research opportunities. So again, a lot of ways to get involved in public health besides just your coursework. All right. And then, of course, you're always thinking about what's next, right? Your career outcomes. We have a wonderful career services program director who is there to support your career exploration and everything you need to get to your goals. So we do activities like career counseling. We do a career expo. There's a intern for a day program, lots of panels and different mini events. So lots of things to support you in your career pursuits. And then at the university overall, I also want to highlight that we have an office called the Health Professions Advising Office. So if you are a student who wants to go into a health profession, again, like medicine, dentistry, physician assistant, etc., that office will help you in that pursuit too. So they help with course recommendations, recommending your timeline, all of that. So it's a really wonderful resource that's available to any student at the University of Maryland. And for those of you who might be out of state, we are in a really wonderful location for public health here at the University of Maryland. Nearby us, we have lots of different public health departments for the county, for the state, hospitals, insurance companies, government organizations, right? There is a lot nearby us. That means there's a lot of internship opportunities as well as future career options for you too. Okay. And then finally, if you're thinking about what's next already, I do want to advertise that we have an accelerated BS plus MPH program. That is a program that allows you to do your undergraduate degree, so your Bachelor's of Science, in addition to your Master's in Public Health degree, your MPH, in a total of 5 years instead of 6. So the way it works is you start taking your graduate courses during your senior year, and then you finish in just 1 additional year, right? So that is an option that saves you time and money, especially if that's something you want to do. And for the MPH, there are 9 different concentrations available. So you can get deeper into a public health topic, right? So you can get deeper into things like epidemiology, health equity, health policy, etc. So again, a really great way to save yourself some time and money if you know you want to earn that MPH degree. And then our newest accelerated program is our 3+3 Knies plus DPT degree. So this is a partnership with the University of Maryland School of Medicine's Doctorate of Physical Therapy program that will allow you to be here at the University of Maryland for 3 years pursuing your Knies degree. And then you go to the University of Maryland School of Medicine in Baltimore to earn your DPT degree. And again, this would be in a total of 6 years instead of a total of 7. So again, saving you some time and money if you know you want to be in the Doctorate of Physical Therapy program. Okay, so that is my spiel that covers some of our basics. I want to invite our wonderful student panelists who are here to go ahead and bring yourselves on camera and get ready. We will now switch into our student panel portion of the event. And let me go ahead and stop sharing my screen so that we can see everybody. Thank you for being here tonight, current students. You are greatly appreciated. I want to first start with a couple of scripted questions, and then we'll go into questions from our audience. So students who are here in the audience and joining us, please don't hesitate to drop questions in the chat. You can do that now. That way I have them queued up and ready to go, okay? And they can be questions for me or our student panelists. All right, so let me start off with a round of introductions first, okay? So I'd love for each of you to introduce yourselves with your name, your major, your year, your hometown, and your current career goals. All right, so I know that's a kind of long list, so I'll help you if you forget something. And what I'll do is I'll call on each of you, and then if you don't mind, let's try to keep the same order for all the questions. That way we don't have to kind of shuffle around too much, okay? So I'm going to go in alphabetical order by major, if you don't mind. So Grace, I'm going to have you go first as our family health major. Can you please introduce yourself with your name, your major, your year, your hometown, and your current career goal?
Hi, I'm Grace. I'm a family health major. I'm from Montgomery County, Maryland. I'm a sophomore. Trying to remember everything. Um, my current career goals are I want to get my master's in social work following graduation and work for the foster care system and support children and families. So I think I got all of them.
You did, absolutely. Thank you, Grace. Good to have you here with us. Mia, I will come to you next from Global Health.
Hi everyone, my name is Mia Owens. I'm a sophomore global health major. I'm from Bowie, Maryland, and currently my career goals are to get my JD after undergrad, and I'd love to do some legal advisory work for some sort of international healthcare organization. I think I got
Yeah,
everything too. I hope.
you did, absolutely. Thank you, Mia. All right, Morgan, I'm coming to you next for kinesiology.
Hi, my name is Morgan. I'm a kinesiology major. I'm a junior. I'm from Westchester, New York, and right now my career goal is kind of like all up in the air. I'm definitely interested in pursuing something in sports medicine, but I'm not exactly sure yet if that's like physical therapy, athletic training, or like sports physician.
Mhm. Thank you for being here. Meher, I'll come to you next.
Hi everyone. I'm a public health practice major. My name is Meher, and I'm a junior. And my career goals are centered around healthcare management. I'm really interested in patient experience and customer success in the like life science industry. So yeah, that's sort of
Mhm.
what I'm thinking about.
Yes, awesome, awesome. Thank you. Alejandra, next under public health practice.
Hi guys, I'm Alejandra Mata. I am a public health practice major, but I'm a senior, but I'm also a first year MPH student as well in the BS plus MPH program. My concentration is behavioral and community health. I'm from Baltimore, Maryland, and then my career goals are after I'm done with my MPH next year, I hope to go to nursing school to then become a community health nurse and worked in underrepresented communities, specifically around sexual health and reproductive health.
Awesome. Thank you for being here. And last but not least, from public health science, Arnav.
Hey guys, my name is Arnav. I'm a freshman public health science major. I'm from Jersey, and for my career goals, I want to be an emergency medicine physician.
All right. Thank you all again for being here. Um, I am going to go to my next scripted question, which is why did you choose the University of Maryland and why did you choose your major? So for those of you who might say, like, oh, I chose it because it's like close to home, or I chose it because the cost was inexpensive, either because you have a scholarship or you're in state. Think about why else you chose the University of Maryland too. So you can list those. But we may have some students who are coming from out of state, who might be, again, going a little bit further. So think about what else has drawn you. Like, what have you come to love about the University of Maryland too? Okay, so we'll keep the same order. So Grace, why don't you go ahead?
So I chose the University of Maryland really for my major. When I was looking at a bunch of other schools while I was applying, none of the schools I was looking at really had like a family science, which is what it was originally, or like a family health major. A lot of the schools offered like a human development major, which is a little bit different. The family health major looks at more of like relationships as opposed to like the individual. And so that was something that was really interesting to me about Maryland. Obviously, for all the reasons that she said, like it was really comforting to me to be able to go to a school that was in state, but I was also definitely really interested in this major. And I've been really happy with all the courses and the curriculum that this major has had to offer. It's definitely one of the smaller majors within this school, but I really recommend, even if you just take a few of the family health courses as electives, they're really awesome. So.
Yeah, thank you. All right, Mia.
All right, so I definitely was going to start listing the unoriginal answers. Oh, finances, which definitely played a part. I was able to receive a scholarship from the university. But besides that, I really enjoyed my experience just coming to campus and visiting. I came from an HBCU family, so I wasn't as familiar with schools that were not HBCUs, and so I didn't know what the culture was like. And I was kind of intimidated by that because I didn't really have a point of reference for my college experience that was outside. Like my family went to Howard. So it was very different for me, and I felt like it was the first school outside of that experience that I could really see myself going to. I really liked the idea of, even though it's a big school, I felt that each college had its own definitive relationships, which also made it less intimidating. And then once I decided to be a global health major, I've truly loved my experience at the School of Public Health. Like I have no complaints at all. That's something I talk about all the time. Like my favorite part about being at Maryland has been the School of Public Health. So yeah.
Oh, we love to hear it. Thank you, Mia. All right, Morgan, why did you choose Maryland and kinesiology?
I chose Maryland because, well, one of my biggest things is I knew I wanted to go out of state, and like ever since I started kind of my college process. And I really enjoyed how Maryland had a great balance between academics and athletics. As a kinesiology major, I like do have to say I do love sports. I love that environment, and having a great balance between the two was something I really looked for. In addition, like specifically with the kinesiology major, I loved how well rounded it was. It wasn't predominantly science classes, it wasn't predominantly like social science classes. It was very universal, which is something that I love about it.
Yes, agreed. I think it really does have that kind of nice, like broad approach to things. Thank you. All right, Meher, what about you?
So, my freshman year, I was actually at a different university and I transferred into Maryland for my sophomore year. And I was also going through a transition from thinking about med school and like the like more clinical area. And then I realized I'm much more better suited for like the organizational side of healthcare. So really what I was looking for with Maryland and well, it's because I was very interested in the Maryland Public Health program and then also the BS and MPH like dual program that initially that was what I was very interested in. But also the university I came from was it was not very diverse, and that was something that I realized was a very important factor in any community that I'm going to be in. So, and especially in the public health major, I think diversity is one of the biggest strong suits with UMD and then also the major. So, yeah, that was definitely the biggest factor for me.
Yeah, awesome. Thank you. Alejandro, what about you?
Yeah, I'm gonna say the boring answer first. It's in state. As someone from Baltimore, there are a lot of schools in Baltimore, but I felt like none of them really resonated with me and what I wanted to do. Plus I did want to like experience things on my own. If I stayed in Baltimore, I would have commuted to the schools that I applied to. In Maryland, I was not going to drive an hour there and an hour back every day. So I wanted to kind of gain that sense of freedom and independence, but also still have my family an hour away if I need them. And then in terms of like school, I did come on like a tour, a very unofficial tour. I had older friends that were here at the time, and my senior year, I just came and I followed them around to all of their classes. And it was like a really beautiful spring day. It was super sunny out, really nice. And like it just felt like somewhere that I was supposed to be. After touring other schools, I never felt like that's where I needed to be, or I never felt like not welcomed, but I just didn't feel the sense of community that they talked about. But at UMD, I really did feel that and I loved it. So I remember that same exact day. As soon as I got home, I committed to Maryland and I was like, this is where I'm going. I love it here. And that idea that those thoughts have not changed. I love it here. I don't regret coming here at all. I'm so happy that I get to be here at Maryland and then continue my education here as well because I'm also going to get an MPH from here. Um, but in terms of my major, I initially came in as public health science, but I always knew that I wanted to work in communities. So after my freshman year, when I kind of realized I wasn't necessarily, not that I'm not interested in the science aspect of public health, it just wasn't what I wanted to work in. And I was more interested in being immersed in communities, understanding their backgrounds, their strengths, and the different things that happens within their communities, and applying that to creating interventions or providing them with resources that can help, that are unique to them and that can address health disparities. So I switched to community health, which is now public health practice, and I absolutely love it. I'm so happy I changed my major and I love my major so much. So yeah.
Yes, thank you. I'm very glad you visited on that one particular day, and that you fell in love with it. I love it. Well, Arnav, what about you? It was not that long ago that you had to make the decision to come to Maryland. Tell us about that.
Yeah, so I mean, you touched on it earlier in your slideshow, but I think one of the things people don't realize is how crazily amazing this location is, where it's located. I mean, you're an hour from Baltimore, you're like 30 minutes away from DC. And just being that close to the nation's capital in such a large city, you have so many opportunities, whether you're going into any of the fields in the School of Public Health or anything else, even. There's just so many opportunities. There's so many people around you that have connections to places that you could work in the future or get jobs, internships, research. I mean, it's a great place to be in. And coming from a place where it's very suburban New Jersey, I do like the suburbs a lot. So I never wanted to go to a school in like the city and like be in like a New York type of city or like a DC type of city. So Maryland is the perfect balance because the city's right around the corner, but you still get to go outside every day. You get to see the green grass and you get to see people playing outside. And I feel like that's just so important to have. And then as for my major, public health science, so I knew I wanted to be a doctor, a physician, but I'm not a very big science nerd or super into like all of the biochem sciences. So I just need to do enough science to become a doctor, but I don't want to go above and beyond. I'm not a big biochem guy. So public health science was that perfect combination between the sciences you need to get to your career goals, but it also has the humanities classes, which oftentimes you don't get in other science majors. Like if you're a bio major or chem major, you won't get classes talking about public health. And I thought that was really important. So that's why I chose the school and the major.
You all. I love all these answers. I'm going to pause real quick because we have two questions in the chat. So one of the question is, what's the community like among public health students? Is it more collaborative or competitive? So see if maybe one or two people, if you have thoughts on that. Yeah, Alejandra?
I can only speak for my major. I can't speak for other
Mhm.
majors, but I would definitely say within public health practice, it's a lot more collaborative. I would not say that it's competitive in the slightest. And because we're always working in groups and we're always working together to find a common goal. Like for example, I'm in a class right now
Mhm.
making it's Health 391 or yeah, 391, which is like making a difference in
Mhm.
community. We actually partner with a community partner or with a community organization, and we create a deliverable or multiple deliverables to kind of just connect with the community and provide them with like resources that they need. And like that's not a space where being competitive would get you anywhere. Like if you're being competitive,
Mhm.
you're not gonna be able to create a deliverable that is actually successful. So like I feel like at least for public health practice, they do a really good job at making it so that we're collaborative, but we're not competing with each other to get somewhere. And I really do like that. And I think that was also one of the reasons, and I'm not saying public health science is like this. I didn't get far enough in public health science to know like about the public health science classes, but at least in like Chem 131 and then like BSci 270. Like I felt like that was very competitive and like for me that just wasn't the environment that I thrive in. Like I thrive in working with people. So I think my major does a good job of that.
Sorry, Mia, you want to weigh in too?
Oh, yeah, I was gonna say I've had a very similar experience to Alejandra. I haven't felt much competitiveness at all. And I feel like for most people I talk to, because a lot of my other public health friends are actually not global health majors, because my major is so new, very small department, so we're still in development. So I think that might contribute to it. But in general, when I talk to people, I haven't had too many experiences where somebody said it just feels really tight. But I definitely felt that way when I had to take my bio class. But also, I'm not a big bio person, so maybe that's why. But I think something that contributes to the lack of competitiveness, but still keeps us collaborating with each other, like Alejandra was talking about, is that the school doesn't necessarily have that scarcity mindset because there are so many opportunities available. I think we would all naturally be clawing at each other and much less likely to want to be in these teams, to want to take part in this collaborative coursework if there were not so many different ways to approach the School of Public Health, if there weren't so many programs, so many activities, internships, etc. available. I think because we have so much at our fingertips, like competition would kind of be counterproductive.
Yes, great answers. Thank you both. If Griffin, if we did not answer the question satisfactorily, feel free to follow up in the chat and we can clarify a little bit more too. But I want to move on to the second question about I'm a potential transfer student for next fall. What resources are there to make the transition process easier and feel integrated into the community? So Meher, I know you transferred in. Do you feel comfortable answering that question? I have like 1 or 2 bullet points I can talk about too.
I will say that I haven't used the like traditional transfer resources that are provided, but I will say that I do look at the transfer student newsletter that comes out every week or every month, which is helpful for just like knowing about things on campus and certain events that could be helpful, especially like your first semester as a transfer student. I think also what you'll notice a lot, at least for the public health practice major, is that there are tons of students who come into the major during their like junior year or maybe like sophomore year. So as a transfer student, I thought I'd be a lot like more behind in coursework and just understanding the major and like my way about classes. But I realized that a lot of people were in the same boat as me, even if they weren't a transfer student, like they may be a transfer student into the major. So noticed that a lot, which was really good support, just like having, you know, UMD students who are also like maybe newer to the major. We're kind of like in the same boat and had each other to kind of lean on for support. So that's like my 2 cents about being a transfer student, that it may seem like daunting in the beginning, but I think specifically like public health practice and just any major in the college, it's a great major to transfer into.
Thank you. Yeah, the one thing I will add that we may not have had when you transferred in, we now have a transfer transition class that is offered specifically in the School of Public Health, and it is taught by School of Public Health advisors, and it's for just School of Public Health students. So it's typically a class of 20 or less students, but it's kind of this transfer transition where we talk about like resources, getting to know the School of Public Health advisors and opportunities and stuff. So think about like, you know, you normally have like a freshman transition class. We now have one for transfer students as well. So it's a great way to really get plugged in with the SPH community and really like kind of kickstart your experience and access to different things. Even if you can't take the class, I know all of our majors do have a really great number of transfer students. So all of our advisors are very used to working with transfer students, and same for our professors too. Okay. So same thing. If you have any follow-ups, feel free to drop them in the chat. And I'll look for fresh questions too. But up next, I will move on to my question about what has been your favorite class in your major and why was it your favorite? So let's see, Grace, I'll come to you first again. What's been your favorite class in family health?
My favorite class in family health was actually an elective I took. It was called, it was FMSC 190, and its title is Man Up, Where Are the Fathers? So that class is on toxic masculinity, and absent fathers, and just like the effects of toxic masculinity, on men in our society, on different races and as they age, and just how it affects not only themselves, but the influences from society, and their relationships. So I thought it was really insightful, and it was definitely a different class. You know, it was one of the first classes I took within the family science major, and it was one of the foundational classes where I was like, I love this major. This is so cool and this is so fun. So definitely a unique class, and I recommend to anyone who needs a good elective or lower level elective.
Yeah, did you have to do the project where you interviewed like a male figure in your life about like their experience as either fathers or father figures? Did you have to do that
Yes.
project?
Yes.
It's really cool because again, you're kind of reflecting on your own life and applying the principles from the class to your own life and your family relationships.
Definitely.
Yes, I've heard wonderful things about that class. Thank you. Mia, what about you? What has been your favorite class for global health so far?
So I'm kind of stuck just because with my major, a lot of the specific global health department classes I take a little bit later. So right now I've been doing a lot of our options courses, which if you come to UMD, you guys will get familiar with the options course, but it's this class called Health 230, which is health behavior. Probably my favorite class that I've taken so far. I think one, because I really love the professor, Dr. Fryer. He's very passionate about his work and so engaging, and he's had such a depthful career and has done so much research. And so it's very easy to, sit here and listen to a slideshow and get vocabulary words, but it's different to hear somebody who's actually been in the field doing it. Or, to read a research paper, but your professor wrote it. It adds a different level of engagement. And, we just had our exam today, so fingers crossed I get my A. But it's been a really cool experience, and it's definitely been something I've been able to apply as I think about these things globally.
Yeah, that class sounds very cool. I love Dr. Fryer. Morgan, what about you? What has been your favorite Kines class?
My favorite class is actually something I'm taking right now. I think the course number is Kines 282, and it's about kind of like the basic care and prevention of athletic injuries. It really showed me, honestly, just like how passionate I am about being like playing a role in sports medicine. And it showed me all the different pathways that I can take in sports medicine and like kind of like what the kinesiology or like how they align with the kinesiology major. So I'm not like fully done it yet, so I can't really speak too much on it, but it's honestly been so interesting this past few month or month and a half, and like I'm really excited to like see where it goes.
Yes, that's awesome. And I love the professor for that class too. Dr. Klossner is really awesome.
She's amazing. Oh my gosh.
Yes. All right. Meher, what has been your favorite class in public health practice?
Definitely it's been Health 306. I took that my first year or my first semester in the major, macro influences of community health. And we basically got to learn about like social issues or social public health issues that are happening not only in the country but around the world, which it was a great class to kind of see like what you're learning in other classes come kind of to life in this class because you get to just learn a little bit more about, or like use, well, yeah, use what you learn in other classes, but learn about like what's happening around you that you can actually learn from. And throughout the semester in like small groups, you have to do a presentation on any like public health topic, current public health issue that's happening. And it has to be like very, very specific, which is really cool because I got to like learn about various different community health and global health issues that, as a public health major, a lot of the times we're focused on things that are happening in the US, but this class kind of forces you to see things on a broader scale.
Yeah, that class sounds really awesome. I haven't heard someone mention that one before in the list, so I love learning about new classes myself. Alejandra, what about you? What has been your favorite public health practice class?
I was also gonna say Health 230, health behaviors. I feel like that's a really core, that's a class. I believe it's actually considered one of our core classes for public health practice. But it really set the tone for the rest of my time here as a public health practice major because you learn about different models and theories that then apply, that you will then use to apply to the communities that you work with to kind of understand their thought processes behind certain behaviors. So like we learn about like the social ecological model, which just focuses more on like what we believe in, how our relationships can impact that, our communities, organizations are a part of society, and different things like that. And when I initially took the class, I was like, oh, cool, this is really cool to know. But then after every single one of my classes brought that up and other theories as well. And you really get to see how you genuinely can apply this to real world settings when you're actually conversing with members of different communities. And when you're trying to tackle an issue itself, like smoking, for example, I need to know why smoking is so prevalent in a community. So I kind of understand their beliefs, their attitudes towards it, and how their communities, how their organizations, and how society has impacted their beliefs. And what we can, and what model or what other model or what other theory can I use to kind of work through this issue with them to get them away from participating in said behavior. So I definitely think that was a really interesting class that I didn't realize that I was going to use. But that is a class that I refer back to a lot. Like I go back on Canvas and I go back to the slides when I'm doing things in other classes and I look through it because that's something that I'm going to continue to use as a public health practice major and as an MPH student.
Yeah, I love that. That's so wonderful to hear that you refer back to it so often. Thank you. Well, Arnav, I know since this is your first semester, you are think you're only in like 2 classes required for your major right now because you're taking a couple of different things. So you can either talk about those or talk about a class that you're excited for in the future.
Yeah, I was just about to say I'm taking like all my basic bio and chem sciences classes. I'm taking one public health class, which is Foundations of Public Health. And just based on what I'm learning in that class, I'm sure it'll set up the next couple of public health classes that I do take. However, I actually just planned out my entire 4-year graduation plan and I was filling out my public health options. And one of the public health options class that I really look forward to taking is BSST 334. Is actually the states of emergency, and it's basically how the different either law enforcement, PDFD, health and human services, emergency psychiatry, psychology, and how that works, and how you can see that in the states of emergency, whether that be a natural disaster or something else. And that's something I'm interested in. So I think that's a really cool class. I'm looking forward to taking that.
Oh, yes, that's awesome. That'll be a perfect fit for what you want to do. Excellent. Well, thank you all for sharing. I don't see anything else in the chat right now, so I'll go on to my next question of can you please share some of the things that you were involved in outside of the classroom? So that might be student organizations, that might be internships, research, study abroad, anything like that that you're doing outside of the classroom. So Grace, I'll come to you. Do you mind sharing some of the stuff you're involved in?
So I'm a university honors student. I don't know if that counts as outside the classroom, but so I'm a university honors student in UH. I know honors has a bunch of like different denominations, so I'm in the general UH. Um, I'm also in a sorority on campus. I'm a family health ambassador. I'm also this semester I'm in the SBHL like student mentor alumni program, which I'm really looking forward to doing. Um, and I'm also applying for the intern for a day experience. So there's a lot of great opportunities like through the School of Public Health to just get connected career-wise. Like this is my sophomore year, so I'm like finally acclimated. So I'm trying to like, dip my toes in a bunch of different new things to try out this year. So yeah.
Yes, time to fully spread your wings, right? You figured out the things you do want to try. Time to put that in action. I love it. Awesome, awesome. All right, Mia, what about you? You're also a sophomore now. You've gotten involved in a couple of things. Can you please share some of those?
Yeah. Like Grace, I also am starting the alumni mentorship program this year, so I'm really excited about that. But beyond that, I also just started a new job with the Education Abroad office. So I'm a peer mentor over there. So it's doing a lot of outreach work. So I'll actually be sending some emails to my professors soon about possibly doing some presentations. So yay. I also am an ambassador for this thing called the Seeing Me initiative, which was started by Black female faculty on campus to get more Black women to study abroad. And so we'll be doing our program in the winter. So I'm really excited about that. And I also had the opportunity to study abroad in Greece this summer. So that was an amazing experience. At the School of Public Health, I am an ambassador for my major. I'm also a member of the Dean's Undergraduate Advisory Council. So that's been a really interesting experience to get started with. And yeah, so it's been pretty busy.
Just a little bit, yeah. Well, come present to my class anytime. You're welcome. We can talk about more study abroad options. Well, thank you, Mia. Morgan, what sort of things have you been involved in on campus?
Okay, so I'm like trying to think of where to start. So I'll start with like outside organizations. So I am the vice president of finance and operations for my sorority. Shout out Grace, she's actually in my sorority. I also was fortunate enough to conclude an internship last semester with the strength and conditioning department at the University of Maryland, and then am now about to start an internship with ATI Physical Therapy as like a PT tech with them. Let me think what else. I'm an undergraduate TA for an upper level kinesiology option that actually is in the works of becoming a study abroad opportunity in Jamaica. So definitely, if you're interested in that, literally you can email me or like I can talk to anyone about it. I love it. And then I was also fortunate enough to do some research in my freshman and sophomore year where I researched how ribosomal proteins affected cancer cells. So I think that's pretty much a general. I'm in a few like clubs here and there, but those are my main things.
Yes, that certainly keeps you busy. Yeah. Thank you, Morgan. All right, Meher, what about you? What sort of things are you involved in?
So, within the School of Public Health, I'm a CHAMP Lab ambassador. So that is the community health engagement or community health awareness messages and prevention lab, which is basically a lab that focuses on health disparities and cancer disparities within the African American community. So I do social media management for them, and then try to help out with like tabling and paneling whenever I can. And then I'm also a peer supporter for Lean on Me, which is a sort of like a warm line, not a hotline for just like emotional support, mental health support for students on campus by other students. And then this isn't with the school, but I have a part-time job, which keeps me kind of busy at a doctor's office. So I work in administration as well. So yeah, that's sort of what I'm keep myself busy with.
Yes, I was just talking about the Lean On Me hotline to my students the other day. So thank you for your work on that.
Yes, shout
Um,
out.
yes. Alejandra, what about you? What sort of things are you involved in?
Yeah, so to start, I am an ambassador for the public health practice major, and with that, we just connect with our advisor, Larry Hoffman, and we kind of just talk through some issues that exist within the major and how we can better support students from student to student. Um, I am also a research assistant over at the Black Health Research Lab, which is under the Department of Family Science. Um, and with that, we focus on masculinity, gentrification, gun violence within Black communities, and what we can do to kind of address these issues that exist within these three realms. I'm also I pulled up my LinkedIn for a second just to remind myself. I'm a TA, an SPHL 100 UTA, and with that, I host office hours. I connect with students whenever they need help with something. I don't grade, but I do help students as much as I can to help them succeed in the course so they can continue being passionate in public health. Um, Outside of SPH, oh wait, no, I lied. One more thing. I am the president of Eta Sigma Gamma National Public Health Education Honorary Society. And with that, we focus on public health education and connecting with communities to kind of understand what's going on and then provide them with interventions and resources and programs that best align with their interests. Outside of this, oh, there's another thing. I was an intern last semester for the Office of Public Health Practice and Community Engagement over in the Department of Behavioral and Community Health, and that was a really great experience. I got to connect with like different students within the School of Public Health, and just fill in some gaps that exist in the School of Public Health. So we were able to host a research day where people from all across UMD, mainly School of Public Health, but they got to present their research, and I helped to facilitate that. I also spoke on a panel. I held on a different day, I had like a table promoting not public health, promoting mental health and giving free snacks away at SPH during final season to promote, healthy eating, keeping yourself fed, because I know finals is a really hectic time and sometimes we forget to eat. So I was making sure to pass out snacks to students and little cards talking about, how to take care of yourself, putting yourself first. If you need to step away from something, it is okay to. Um, so that's something I did outside of this. This past summer, I had an internship over at the University of Maryland School of Nursing in Baltimore, where I got to do research on palliative care, which is like hospice care, but it doesn't necessarily focus on end of life. It's just more focused towards comfortability throughout chronic disease. And hospice does fall under that. So also people that are terminal as well. And that was a really interesting experience because I got to do research on something that I wasn't really familiar on. I focus, like, as a public health student, I focus more on public health, and that was just not public health related, but it was also really cool because I got to experience something new. And it opened my eyes to different things that exist, different areas that exist within nursing. So yeah, that's a little bit of what I've done or what I continue to do.
Yes, and it's awesome to see, the breadth of different things that you can do, right? Like it doesn't all have to be in one particular sphere tied to one particular aspect of your major or anything. There's a lot of different things that you can explore.
Right.
Okay. Arnav, I'll come to you next, but I also want to say, students, if you have any final questions, feel free to drop them in the chat. Otherwise, after Arnav's comments, we will start wrapping up. Okay. So Arnav, I know you are in your very first semester, so you are just starting to get involved in things. But what have you started on so far?
Yeah, I mean, I was just about to say everyone else goes on and on. I don't have that much to talk about for this question because I'm still new here. But for the things I have gotten involved in, I'm part of Mall UN. I'm a crisis director there. So that's pretty cool for me. I get to be part of that. And then I'm also part of Maryland Minza, which they host a dance competition every year, and there are different schools that come and perform there. So I'm on the board for that, which is really cool. And then I think the thing that takes up the most of my time is I'm a volunteer firefighter EMT here in College Park, Maryland, and I not only respond to the area in College Park, the university, but the greater Maryland area as well. I'm a live-in firefighter EMT, so this dorm is actually on the second floor of the fire station here on campus. So I live and I work here. I work like 2 nights on, 2 nights off, so I work almost 80 hours a week firefighting EMT on the ambulance and on the fire trucks. And yeah, it's a pretty cool gig. So I get to do that while I go here. So I think that's pretty interesting.
Yes. You can see everybody keeps themselves very busy. So definitely no shortage of opportunities here. I do see a question in the chat about how much flexibility is there in choosing electives. All right. So I will clarify real quick that there's electives, depending on how you're using the word, it could refer to a couple of different things, right? So when you think about your undergraduate degree, right, it's made up of things, 3 things, right? It's your major requirements, your general education courses, and then electives, right? So major requirements are things that you need to get to earn that particular degree, right? So if you're a public health science major, for example, you have to take organic chemistry, right? That is a major requirement. There are other classes that are general education courses, right? So everyone has to take a little math, English, history and social science, humanities, etc. So those are gen eds. And then electives are anything that is not a major requirement or not a gen ed, right? So elective might be something that is like totally free choice, like you're taking that just for fun. Or it could wind up being something that is part of another passion or another goal of yours, right? So an elective could technically be things like classes for your minor, classes for like Grace mentioned, university honors, right? So it's sort of just things that aren't general education courses and that aren't major requirements. Sometimes if you have some particular goals, your electives might get eaten up by those things, right? So if you're wanting to add a minor, if you need to take some extra classes for being a pre-health student, right? For going to medical school, like those might wind up being some of your electives. But it is totally free choice how you want to spend those. So it could just be like fun classes that you're interested in, or it could be dedicated to some of those things. The other way you might hear people talk about electives is that all of our majors require you to take some upper level courses in the major. And so they might be called upper level options or upper level electives. And they are essentially classes within the major that you get to choose, right? So like Arnav talked about the emergency preparedness course. Somebody else talked about one. Mia, you talked about one that it was the health class, right? So you get to pick those too. So I don't, does one person maybe want to share their experience with either electives or Arnav?
Yeah, I mean, I just did my 4-year plan with all of the degree building. So I was literally on like all of the schedule of classes for like an hours on hours the other day. So when you want to choose your electives, like if you get a 4-year plan for your major, it'll give you spots in certain semesters to take an elective class. And that spot, all it says is elective. So like there's some electives that you can take that are completely outside of your major. There's some electives you can take that are restricted to your options classes, which is also a long list of like 40 different classes that fall under that. And there's also like lower level electives, higher level electives, or just general electives that you can take. So as like a public health science student, I could still take an elective in like the School of Business, for example, or I could still take a kinesiology elective, just wild any elective choices. So there is a lot of freedom and flexibility when you want to choose them, and when in your 4 years you want to take that elective. So if say you're busy on your major related classes in your first 2 years or in your last 2 years, you could take more electives earlier on.
Yes, it is nice to be able to sprinkle them in a little bit, right? So you're not getting overwhelmed with one particular area, or one particular topic. So hopefully that answered your question. Otherwise, feel free to ask a follow-up in the chat. So what I'll go ahead and do right now, because we are at 9 o'clock, I am going to go ahead and just share our final steps here. So hopefully, those of you who are on the call, you liked what you were hearing and you are considering applying to the university. And if so, please do apply to Maryland. I strongly encourage you to apply by the early action application deadline, no matter if you're a freshman or transfer student. That is your best chance of getting into the university. So check the admissions website for all of those dates and deadlines, and for any guidance on doing your application. And of course, we are here to help if you have more questions about public health. I am doing a few more in-person events this fall, so you want to come see us in person, you can scan this QR code. I'll send it out via email as well. So you can come see us in person if you want to. And you can always schedule follow-ups with me as well. All right, and then finally, if you think of a question you didn't get to ask, this is my email. I respond to the futuresph@umd.edu email address. So feel free to reach out if you have any questions after today. I'm also happy to pass questions along to our students if you think of something you want to ask them, and we can get back to you that way. All right, so thank you so much for joining us tonight. Like I mentioned, after tonight, I will send you an email. And one of the things that I'll do is I'll include the link to our course lists. I think that is one of the most important things you can do as you're researching courses is look at the classes that you actually have to take for the different majors. And the hope is you're getting excited about all those classes. If you're looking at them and you're dreading them, that might not be the best fit for you, right? So that can be a helpful tool for comparing between majors if you're choosing between programs, or even between universities, right? If you're trying to compare, for example, our kinesiology program to one at another university, okay? So I'll send you links to our class list as well as some of the other opportunities and stuff that were mentioned tonight. And like I said, feel free to reply to the email if you have any other questions or need anything else. Happy to give you some assistance. All right, so thank you to our wonderful student panelists. You all did great tonight. Thank you attendees for coming out and sticking on with us. I hope you all have a wonderful evening and good luck with your application process. All right, have a good night, everybody.